feel free to ramble, feel free to,
that's the
go back on a thought, that's, we have all the time in the world, except we only actually have 19 minutes. So there is that. We noticed a bunch of origami lying around your office. Can you tell us a bit about when you got into that habit?
Origami is something I discovered early in medical school. It's very relaxing. I think from a surgical standpoint, it's helpful for dexterity, and it's kind of an exercise in kind of the spatial relation between trying to figure out the diagram and the plans and see if you can make this flat piece of paper turn into something that's recognizable. Urology we often think of as the most medical of the surgical specialties, from the standpoint of still engaging and embracing kind of a diagnostic modality and a process, in addition to seeing patients through therapy, whether that be medical, behavioral, or surgical. In discussing the urinary tract is one of those systems that the average person knows very little about. When it's working well, we take it for granted, and when it isn't, it becomes a very sensitive and personal issue and a lot of problems surrounding that. So I think part of our role as doctors is not just on kind of the therapy end, but really on part of our role is to teach patients about their body, about why these systems may not be working the way we want them to, or what has gone wrong. And in being that teacher or having them understanding, I think that a number of things come out of that. They are able to make better decisions about their care, to participate in that process. And also I believe that their outcomes of those things are better. There's much less of a kind of surrender process and more one of participation. And the party that knows best when to do surgery is really the patient. And I see my role more as one of kind of laying out the options and kind of managing the pros and the cons, the benefits, the risks in a way that one has a fair bit of latitude and, as I said, opportunity to decide if and when.
Finally, Dr. Wright, your patients place immense trust in your hands, both figuratively and literally. Why is it important that you not simply allow patients to let you make all of the decisions?
Yeah, well, I think that trust is something that I think all of us, certainly in surgery, take very seriously. Again, I'm always honored and feel really privileged to have patients place that trust, and I think it really, with that, I think comes tremendous responsibility, and we try to live up to that.
Dr. Wright, thank you very much for your time.
Appreciate that. Thank you.
Yeah, that was A CLOSLER Look.